Hi, this is Becky Bryant from Lakes Region Community Services, and I'm here to talk to you today about conflict in case management. So please don't shut me off. This is not your usual Friday dose of Bob Marley making us laugh and sometimes cringe. And this is not the hillbilly weatherman coming to yell at you about the impending snowstorms. It is just me here to talk about conflict in case management and our corrective action plan and what we're doing here at Lakes Region Community Services on this topic. So if you are listening still, it's because hopefully you're a stakeholder that has received a letter from us over the last few years, has come maybe to a local forum on the topic, and maybe even attended one of the statewide stakeholder groups on the topic. And even more hopefully, you're somebody who has not done any of those things and engaged with us on the topic because the topic is just difficult to break down and understand, and you looked at my letter and added it to the pile of junk mail that you received in the mail over the last couple of years, and I don't blame you. However, it is a real issue, it is a real topic, it is something that we are taking very seriously, and I wanted a chance to chat about what it is. So what it is this. There is a rule from CMS, the Center for Medicaid and Medicare Services, and that rule is on the books, it's been on the books for a while, that says that the same entity cannot provide case management, which we call resource coordination here at Lakes Region Community Services. Could be referred to as service coordination, case management, resource coordination. If you're providing those services, you cannot also provide direct, what we kind of call hard services sometimes, to the same individual. What are those services? That's your residential services, that is your community participation services, your vocational services. Can't be coming from the same entity. So if you're currently an individual served by Lakes Region Community Services, the chances are pretty high that you actually are receiving both your service coordination from a resource coordinator here, but you could also be receiving your community participation services from StaffWorks. You could be receiving residential services through shared family living or enhanced family care or 24/7 residential services. And what CMS is saying is that we can't do that any longer. That's what the corrective action plan says, that as of August of 2021, if we're billing the waiver, which is what we bill in order to access the Medicaid dollars, that your services need to not be conflicted. And again, definition of conflicted is you are receiving both your service coordination, case management, and your direct services from the same entity. What does that mean here at Lakes Region Community Services? Well, what that means, first of all, is that we haven't panicked. We've been very thoughtfully moving through this process with the state and with CMS for a couple of years now, moving towards a path of compliance. Compliance means that internally, we've also strengthened, for those who are receiving services from us currently and case management, we've really strengthened our internal structure. We have a Vice President of Resource Coordination, Bob Landry, and also a Vice President of Services, Shannon Kelly, who makes sure that we have the interests of the individual at heart, but being represented very specifically by two very different departments within the walls here of Lakes Region Community Services. We have literally physically separated the staff that work in the separate departments. The two vice presidents report to me so that at the end of the day, we can mitigate the chances that the case manager is not able to fully advocate on behalf of an individual because the same entity is providing services. And that's really the premise of why CMS has this rule, to say that at the end of the day, in one organization, we're not going to be able to have a case manager fully advocate when they're reporting to the same entity that's providing the services. That we have a conflict, right? We want to make sure that our business is whole at the end of the day, and that is going to be primary to us meeting the interests of the individual. We have no issue with that. We understand the premise of the rule. We have a lot of challenges around that rule. We obviously have a very significant workforce challenge. If you are related to us as a family member, as an individual, or as a staff member who's listening to this right now, we live it every single day. You've heard me say many times that workforce crisis doesn't define anymore where we are at with that. We also have a lack of providers in this area, and we have been working very diligently to, particularly on the side of independent case management, meet with independent case management agencies, make sure that we're providing all of our families with lists of who are the potential service providers, both for direct services and for case management, and being very transparent, open from the day that you interact with us, from day one, that you have choice and control. And we believe that choice and control has actually always built into the New Hampshire system for developmental disability services, and that we can always take the chance to strengthen and be more transparent and more policy driven around independence, choice, and control. So we are doing all of that work, and certainly for anybody new coming into services, we'll be fully prepared to be compliant with the CMS regulation. That being said, we also believe that it still goes back to personal choice, that we built a system that was informed and created because of families. Grassroots advocacy created the area agency system to begin with, and that this rule does fly in the face of independent choice and control because it is taking a choice away from families. And that is the choice of the families that come through our doors that say, we have enough challenges on our plate. This is our area agency. We understand the system that was built here in New Hampshire to support and advocate for us, and we are choosing to receive our services from one entity. And that choice is being taken away. CMS, and in order to comply, the state of New Hampshire is saying that as of August of 2021, it's not a choice anymore. You cannot choose the area agency to both be your case manager and provide services. So there's been some letter writing. You might have read some articles in the paper. The governor has actually asked our federal delegation to take a look at this issue because it's not the New Hampshire way. Not having choice and control at the family at the local level, making this decision for you by somebody sitting in an office in Concord or Washington is just not who we are and what we're about. And so from the start, we have also, in addition to compliance, worked on a little bit of pushback and advocacy for our families. And that advocacy needs to go all the way to Washington to say that if a family chooses, the family should have the option to ask for an individual waiver and have their services provided by whoever they want the services to be provided by. And that might in fact be coming through the door, one-stop shopping, no wrong door, come through and we can help you both with your case management and your services. Again, two complete paths in parallel, moving forward all the time: compliance and advocacy for an individual waiver. We're not asking for an area agency waiver. We're not asking for any one entity's waiver to the rule. We understand that the rule is the rule. We are saying that there's many waivers that we ask for different things that come down through CMS regulation, and that this should be one of them, that there should be an individual option to ask for a waiver and receive your services where you want to receive your services. It's pretty much as simple as that. So for our existing families, we are working on looking at what options that you have. We have already surveyed our families and heard overwhelmingly from our families here at Lakes Region Community Services, at least, that if you are currently satisfied with your case manager and your services, that you're not interested in switching. We are still working with you individually. You should be talking with your resource coordinator and looking at August of 2021 and thinking about how we could make your services be compliant. And again, for new folks coming to us, individuals turning 21, aging into our system, coming off the wait list, we are already working with those families to look at how can we help you select either an independent case manager or a service provider that will address that issue of conflict in case management and be compliant with the state's corrective action plan. So I hope that this was helpful for you. I hope that you reach out. And if you are watching this and you are not a current client of Lakes Region Community Services, but possibly one of the other area agencies, I really encourage you to get in touch with either your service coordinator or go right to your executive director. Say, I want to understand more about this. I want to talk about how it impacts me. And I encourage you to have the same open mind that we have, which is that there's a path to compliance, but there's also a continued path for advocacy. Nothing about us without us has been the rallying cry since well before my time here. And I believe that that should still be the case, that it is up to families to advocate and let both Concord and Washington know where you stand on this, and fully recognizing that you might be fully in agreement with the corrective action plan and the concept that conflict is an inherent problem. I am not in any way trying to say that there are not more than one way to look at this issue. I'm saying please look at the issue, please understand the issue, and please learn about how it impacts you. And if you need assistance with any of that, you are always welcome to call your executive director, case manager, whoever you can get a hold of that you feel you could have a really good conversation about this issue with. So With that being said, have a happy Friday. I will throw out there, it's really easy to contact me. I always give my email address, however, because it's really hard to catch me by phone. So you can reach me at rebecca.bryant@lrcs.org. If you have questions, if you need to know who to be connected with, I encourage you to do that. Shoot me an email. So it's rebecca.bryant@lrcs.org, and I look forward to hearing from you. Thank you.